One treatment we use at our office is dry needling. So dry needling is when we use a acupuncture needle and we place it into a knot or a trigger point to cause that muscle to relax and to release. It's different than acupuncture in the sense that this is just a muscular treatment. It's a very effective treatment. What's great about it is you can apply it to many different areas in the body. I'm going to demonstrate what it looks like to do dry needling on your quadricep muscle. So what we're going to do is we're going to find some of these tender spots. And again, a lot of times these will also be the painful spot when a patient comes in and they'll say it hurts right here. Often that's an active trigger point or a muscular knot. So I'm just palpating Renee's quadricep, feeling the spot. Okay, and then what we're gonna do is we're gonna take one of the acupuncture needles, and basically what the patient is gonna feel is a little tap. That's me tapping it in. They may not feel anything more than that. Sometimes though, in a powerful muscle like your quadricep, you may feel the muscle do a little twitch. Okay, that's called a local twitch response, and that's completely normal. And when you get that, you may notice that like an achy sensation when we put the needle in. And what that is, it's kind of the relaxation of that knot or the trigger point and kind of resets the muscle. So it's different than a regular massage where that's more of a mechanical rubbing of the muscle. Because we're putting the needle into the knot or the trigger point, it creates a neurological reaction which relaxes the muscle. When we do that, it gets a faster response. So as opposed to needing several visits of some manual therapy or massage on the area, 1 or 2 treatments of the dry needling will resolve the issue. So it's a much faster response, and often patients get off the table and they notice a difference right away. So what we're gonna do is we're gonna palpate the quadricep, and we're gonna check out a couple different areas here. Okay, so I'm feeling an area on her that is a little tight. So we're going to place the needle just like that, and we're going to insert it into the tissue. Okay, so like right there's her spot, and that's it. So that's a real quick treatment. Now, if I wanted to, I could take the needle out right away, and that's just a treatment in itself right there. Sometimes what we'll do is we'll also add electric stimulation to the needle, which will cause like an artificial twitch and cause the muscle to gently twitch back and forth like that. And that's another way we use it if a person is really chronically tight or we're trying to get more of a reaction inside that area. We can apply the electric stim to the needle, which will cause it to twitch more. So what I'm going to do, I'm going to also apply a couple more needles in here, and then we'll apply some of the electric stim to it so you can see what that looks like. Again, whether or not you use that, it just depends on the case and the type of issue that the patient's dealing with. Also, certain areas we like to use the stim more than others. For example, the calf area works very well on. One of the advantages of using the electric stim is we don't have to place in as many needles into an area in order to get the reaction. We can use the stim to assist us. So let's apply a couple more into her quadricep. So Renee, what would you describe that feeling, what it feels like when I place the needle in, and what you experience with the treatment?
The second needle you just put in there, I could feel your hands on my leg, and I really didn't even feel you tap that one in. The first one, I did feel a little bit of achiness when it hit that certain spot.
Yeah, now typically a normal muscle, you wouldn't feel hardly anything. That normal muscle, there's no resistance. When you come to a spot though where there's a knot or a trigger point, what you'll feel is like a hard point and then that twitch of the muscle, and that's the relaxation. And that's usually when the patient will experience a little dull achiness, but it's really tolerable. And like I said, usually the needle comes out right away. In this example, I'm going to apply a little stim to the needle. So this type of stim, what I'm going to do is I'm going to hook up one lead to the one needle and one to the other. And what you're going to see is her quad will start to twitch as I turn on the stim. You can see it jumping around there. Now, because her quads are very strong and powerful, you'll get that big reaction like you're seeing like that. Some of the other areas, you'll feel just a tap, tap, tap. But that's one way that I'll quickly use to help accelerate that loosening up of that tissue and help to get more of a response. So that's one way to apply a hands-on version of the electric stim. Another way we can apply electric stim to the dry needling process is we can use multiple different alligator clips and leads to create the reaction. Now the nice thing with this is we can put it on an area and then leave it on for 10 to 15 minutes at a time. And so in this situation, I have 2 needles hooked up to the green lead and then 2 to the white lead. And what we're gonna do is we're gonna turn it on, and you'll start to see that little twitching in the muscle there. So I'm gonna turn it on nice and slow here. And again, it just causes a little bit of a twitching of the muscle. It doesn't hurt or anything like that. Okay, so right now her muscle's starting to twitch a little bit under the green ones, and now we're going to go to the white. Okay, and there's the twitching of the muscle, and I can dial this up more or less depending on what the patient needs, but that's another way to help stimulate the area and to help to release this. And again, depending on the person and depending on the condition, we may or may not use this at all, but it's just another tool we have in terms of using it for dry needling. I received multiple different trainings in dry needling, so there's different approaches, and it just depends on what the patient needs. It doesn't have to be very painful or anything like that. It can actually be very comfortable and get a really positive, effective result. Dry needling is a very effective treatment for any kind of muscular conditions. What's great about it is we can apply it to multiple different areas, and depending on the injury, you can get to different depths. So if an issue is very superficial, we can go very superficial, or say if it's a glute or a hamstring issue and we need to go deeper, this can get to that area where say my hands or the Graston tool can't get to. This is gonna be the technique that I'm gonna use. If you have any questions about dry needling, reach out to me at 703-912-7822 or schedule online at novachirowellness.com.